Hello, this is Samna, optometrist from the Department of Optometry. Today I am going to discuss on the topic of nystagmus and this is a part 2. The nystagmoid movements, these are ocular movements with mimic nystagmus. They are ocular flutter, opsoclonus, superior oblique myokymia and ocular bobbing. The ocular flutter, which occurs due to the interruption of the cerebral connection to the brainstem, that is, the horizontal oscillations and inability to fixate after the changes of the gazes. The opsoclonus, it's a combined horizontal, vertical, and or torsional oscillations associated with the repetitive movement of the face, arm, legs. It is seen in patients with encephalitis. The superior oblique myokymia, it is characterized by monocular, rapid, intermittent, torsional, the vertical movements which are best seen on the slit lamp examination. The ocular bobbing, which refers to the rapid downward deviations of the eyes with the slow updrift. It occurs due to the pontine dysfunctions. The assessment of the patients with the nystagmus. The degree to which the conditions can be assessed depends upon the patient's age and ability to cooperate with the instructions. Some history and examinations are possible in most of the patients, as they even young babies should look with interest at bright colored object or the light of a pen touch. Next, ask about the history and onset of the age. This will help to determine which type of nystagmus it is and hence a point to be possible diagnosis. Ask the patients when it occurs, when whether it ceases with accommodations and sleeps or the two occasional to inquire about the specifically. Ask the patients about visual related symptoms. Some patients described oscillopsia, the perception of the continual movements of the light visual environment. Generally, if a patient is unaware of oscillopsia, the nystagmus is literally to be congenital condition. Then ask the history of the headaches, tearing, avoidance of the near task, and blurry vision. Ask about the dizziness and the loss of the balance, nausea and vomiting. And ask related systemic symptoms such as regarding to the nervous systems are highly relevant. Then ask the history of the prescribed or non-prescribed drugs, which is important, the particularly anticonvulsants. Then ask about the family history. The examination. Nystagmus can be described in terms of the directions of posture or corrective phase, amplitude, that is, it is fine or coarse, frequency, high, moderate, or low, the waveform is jerk, pendular, or mixed type, the symmetry and the conjugacy if it is an bilateral condition. Note in which positions of the gaze it occurs. Primary positions, which means looking the straight ahead. The secondary positions is looking straight up down, straight right or left. The tertiary positions includes four oblique positions: upright, down and right, up and left, down and left. Then the cardinal positions. These includes all the secondary and tertiary positions. Examine the patient sitting facing you. Observe the nystagmus in the primary positions. Using a small fixation target, observe the nystagmus in all the positions of the gaze. Then ask the patients to comment on the visual problems such as the eye moves. Example, it causes blurring of visions or either double visions, which means diplopia. Enquire about the null point. This is an angle which some patients find minimizes their visual impairment. Is often results in abnormal head position. At school, difficulties arise when copying information from both the books and the boards and from overhead devices. This is particularly due to the difficulties with manipulating the null point to maximize the vision and partly due to the altered visual acuity. The nystagmus can be profound personal and social consequences for young people, affecting the relationships, confidence, educational and work opportunities, and their self image. The patients with a nystagmus can tire easily from the extra effort it takes to look at these things. The patients may also experience balancing problems such as the depth of perceptions may be impaired, even uneven surfaces or stairs may be difficult to negotiate. This may be perceived as clumsiness by the others. Oscillopsia, which means that the tasks such as riding a bicycle, if not possible, are more precarious because of apparent movement of the roadside or parked cars. They may be also associated with the stress and nervousness at being in unfamiliar surroundings, particularly as they are often have the poor vision. Patients often have difficulty in making and maintaining the eye contact. In school, children and students may need extra time for reading and sitting for the exams. Small print can usually be read to the aides, but the children will find it hard to share the books. Thank you.